Every day, millions of caregivers, nurses, doctors, and healthcare staff walk into hospitals, clinics, and emergency rooms with one mission: to save lives. They are the ones who comfort patients in their most vulnerable moments. They stand on the front lines during pandemics, risking their own health for the sake of others. They miss family events, birthdays, and holidays so that someone else's loved one can have a chance to live. And too often, they sacrifice their own well-being so others can survive. But behind the walls of the healthcare system lies a crisis most people never see. A silent crisis that doesn't make headlines nearly enough. That crisis is workplace violence against healthcare workers. It's not just about one incident, one story, or one hospital. It's an everyday reality. Verbal abuse, shouting matches, threats from frustrated patients or angry family members, physical assaults, even harassment from colleagues. These are not rare or isolated events. They happen every single day in hospitals, in clinics, in emergency rooms, across the healthcare system. Now imagine this. A nurse is working the night shift, already exhausted from back-to-back emergencies. Suddenly, a patient's family lashes out physically, furious that treatment isn't moving fast enough. Or picture a doctor who has just delivered heartbreaking news about a diagnosis. Instead of empathy, they are met with anger, blame, and threats. For many caregivers, this is not just a story. It is a daily reality, and the toll it takes is immense. The emotional scars go far beyond the walls of the hospital. Caregivers who face violence report higher levels of stress, burnout, anxiety, depression, and even post-traumatic stress disorder. Some leave the profession altogether. Others carry on, but at a cost, working with fear, hypervigilance, and emotional exhaustion. And when caregivers are forced to work in fear, patient care suffers too. A stressed, overworked, and unsafe workforce simply cannot provide the quality of care that patients deserve. The truth is this: when caregivers are not safe, patients are not safe either. Protecting healthcare workers means protecting the entire healthcare system. So why does this crisis continue? Part of the problem is culture. Too often, violence is brushed off as part of the job. Hospitals and clinics sometimes lack the proper security measures. Reporting systems are weak or ineffective. And many workers stay silent, not because they don't care, but because they fear retaliation or because they believe nothing will change. But silence is no longer an option. Change is possible, and it is necessary. Stronger policies must be enforced. Hospitals must invest in better security systems and training. Zero tolerance for violence has to be more than a slogan. It has to be a lived reality. Caregivers need access to mental health support, counseling, and safe spaces to heal. And as a society, we must raise awareness. We must speak up for the people who spend their lives speaking up for us. Because this is not just about healthcare workers, it's about all of us. One day, each of us will rely on them, or someone we love will. And if they are not safe, neither are we. So, what can be done? It starts with recognizing that every single warning, every safety measure, and every policy exists for a reason. It means hospitals and governments must treat violence as preventable, not inevitable. It means families and patients must understand that frustration and fear do not justify abuse. And it means that together, as communities, we must demand a culture of safety and respect in healthcare. Because at the end of the day, this isn't just a crisis hidden behind hospital doors. It's a human crisis, one that affects caregivers, patients, and the entire healthcare system. It's time to shine a light on this silent crisis. It's time to protect the people who dedicate their lives to protecting us. If you believe caregivers deserve safety, dignity, and respect, help spread this message. Like this video, share it with others, and subscribe to Behind the Warning for more stories that reveal the hidden dangers in our world. Because every warning has a story, and knowing what's behind the warning could save lives.